Hello and welcome. Today we're diving into the complex world of optic atrophy, a condition affecting the optic nerve and ultimately your vision. We'll explore what optic atrophy is, what causes it, and what can be done about it. Optic atrophy isn't a disease itself, but rather the end result of damage to the optic nerve. This damage can stem from a variety of causes. These include ischemia or insufficient blood flow to the optic nerve, often due to conditions like glaucoma or blood vessel problems, compression of the optic nerve, potentially from tumors, aneurysms, or swelling, inflammation or infection of the optic nerve, known as optic neuritis, genetic disorders that affect the development or function of the optic nerve, trauma to the head or eye, toxic substances, such as certain medications or alcohol abuse, and in some cases the cause may remain unknown, referred to as idiopathic optic atrophy. To understand optic atrophy, it's crucial to know how the optic nerve works. It's the crucial link between your eye and brain. It transmits visual information from the retina to the brain for processing. When the optic nerve is damaged, nerve called axons begin to degenerate and die. This loss of nerve fibers reduces the amount of visual information that can reach the brain, leading to vision loss. The optic disc, the visible part of the optic nerve at the back of the eye, changes in appearance. It often becomes pale or white, hence the term atrophy, which means wasting away. Pinpointing the exact frequency of optic atrophy is challenging because it is a consequence of various underlying conditions. Because it arises from a variety of root causes, the occurrences varies widely across the global population. For example, optic atrophy secondary to glaucoma will mirror the prevalence of glaucoma, while optic atrophy caused by genetic mutations will align with the rarity of those specific genetic conditions. Age also plays a role. Some causes are more common in children, such as genetic disorders, while others are more prevalent in older adults, like those related to vascular issues. The symptoms of optic atrophy can vary depending on the severity and location of the nerve damage. Common signs include decreased visual acuity, which means blurry or reduced sharpness of vision, changes in color vision, making it difficult to distinguish between certain colors, reduced peripheral vision, creating a tunnel-like effect, difficulty with brightness and contrast, making it hard to see in dim or bright lighting. In some cases, there may be complete blindness. It's important to note that vision loss may be gradual or sudden, depending on the underlying cause. Diagnosing optic atrophy typically involves a comprehensive eye examination. This includes visual acuity testing using an eye chart, visual field testing to assess peripheral vision, color vision testing to detect any color deficiencies, a dilated eye exam to allow the doctor to view the optic disc, optical coherence tomography, or OCT, which provides detailed images of the optic nerve and retina. In some cases, your doctor may order additional tests, such as MRI or CT scans of the brain and orbits, to rule out underlying causes like tumors or compression. Genetic testing may also be recommended to identify any genetic mutations. Optic atrophy is often classified based on its cause or appearance. For example, it can be categorized as primary or secondary. Primary optic atrophy refers to cases where the cause is directly affecting the nerve, such as in genetic disorders. Secondary optic atrophy results from damage to structures near the nerve, like glaucoma or swelling. Another classification involves the appearance of the optic discs, such as pallor or cupping. Understanding the type can help guide treatment and management strategies. Unfortunately, there is no cure for optic atrophy. Once the nerve fibers are damaged, they cannot be repaired. Treatment focuses on addressing the underlying cause to prevent further vision loss. For example, if a tumor is compressing the optic nerve, surgery or radiation therapy may be necessary. If glaucoma is the cause, eye drops, laser treatment, or surgery may be used to lower eye pressure. In cases of optic neuritis, steroids may be prescribed to reduce inflammation. Low vision aids, such as magnifying glasses and assistive technology, can help people with optic atrophy maximize their remaining vision. Because optic atrophy is often the result of other conditions, prevention strategies vary. Regular eye exams are crucial for early detection and management of conditions like glaucoma. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can help reduce the risk of vascular problems that can damage the optic nerve. Avoiding excessive alcohol consumption and exposure to toxic substances is also important. If you have a family history of genetic disorders affecting the optic nerve, genetic counseling may be beneficial. The prognosis for people with optic atrophy depends on the underlying cause, the severity of the nerve damage, and how quickly the condition is diagnosed and managed. In some cases, vision loss may be minimal and stable. In others, it may progress despite treatment. Research into new treatments for optic nerve regeneration is ongoing, offering hope for the future. Advances in gene therapy and neuroprotective strategies hold promise for potentially restoring vision in some individuals with optic atrophy. Stay informed, work closely with your eye care professional, and remember that early detection and management are key to preserving your vision.